My name is Doris. I'm 86 years old. Up until recently I lived in my own home with my husband Bert, who looked after me. I have dementia. I had a stroke a few years ago and I used some inhalers for a problem with my lungs. I have a hearing aid because I'm a little deaf, but my eyes are fine. It's a good job something works. I like the sunshine, doing crosswords, and I enjoy it when my daughter comes to visit. She takes me out shopping. We both love handbags. I'm not really a morning person, and it takes me a while to get going, have breakfast, a cup of tea, and take my medicines. My husband died suddenly a few months ago, and I couldn't look after myself properly. My daughter found a care home near where she lives. When I moved into the care home, I was really upset. It didn't feel like my home. I didn't know anybody. It was noisy for me. I couldn't get up when I wanted to. Someone tried to get me up at 7 o'clock and the food wasn't like Bert used to make me. I struggled to sleep and the only way I could get myself heard was to shout out. I spent a lot of time crying. I couldn't always understand what the staff were saying to me because I wasn't always given my hearing aid. A doctor came to see me and gave me a little white tablet to calm me down and help me sleep. A few days later I felt a bit better, but I fell over whilst I was getting out of bed in the night to go to the toilet and they took me to hospital. I'd broken my hip and was in a lot of pain. They gave me painkillers and some foul-tasting liquid to take, which I refused. I was tired and grumpy, so I didn't want to take my tablets. I noticed some of my tablets looked different, but nobody told me why. A few days after I was sent home from hospital, they got the doctor out for me at night because I was so angry and crying when they told me to go to the toilet. It hurt me to go, so I tried not to. I was given some more tablets to take. I was in so much pain I took the tablets I was given and the next day I woke up with a rash, so another doctor came to see me. They gave me some medicine and a cream to rub on. I told the doctor I was worried I hadn't been to the toilet for days and my stomach was still hurting. He said he'd give me something to help. The brown tablets certainly did the trick. After a few months I felt more settled. The staff had started to get to know me and I'd made some friends. We used to like playing cards, sitting outside in the sunshine with a cup of tea. My daughter bought me the crosswords. My hip was starting to feel better and I was getting about a bit more, but I noticed my breathing wasn't very good. Some days I really struggled. One day it was so bad the staff called an ambulance for me and they took me to hospital. I still like the sunshine, a cup of tea, and I'm still not a morning person. But thanks to the medicines lady that came to see me, the nurses now give me my medicines at lunchtime. There's not as many now, and no more of that horrid tasting liquid. They should get an award for that.